Hello, this is Robert. Today we will talk about the role of the nurse and community mental health within the Hispanic population. More specifically, we will talk about the role of the nurse as a liaison for African American and Latino is the population we're focusing on, adolescent males, um, the, so that they can be connected to mental health services. So the title of the article that I've read is called "Engaging African American Latino Adolescent Males Through School-Based Health Centers," and um, let's begin. The objective of this article was to understand why do Latino and African American males seek mental health services at school-based health centers. Previous research had shown that African American and Latino males are using these services very frequently, especially when compared to um, community settings, health clinics and community settings. If you take a minute to read these quotes, you will find that information. Um, I want to highlight this quote that the adolescents themselves are reporting that had counseling not been available in the school setting, they would not have sought care. Um, and so this is the jump off point for the research article that I read. Although there is evidence that African American and Latino males seek mental health services more often at school based health centers, research on the reasons why they seek services in this setting is scant. One subject that they discovered when finding was that nurses are the liaison to connect children with need to mental health providers. The reasons for this we can see from our own experiences in nursing. Nurses understand their patients a lot. I especially like this quote, which says, "The nurse's familiarity with the students often results in them being the first healthcare provider to notice subtle changes in behavior and need for mental health care." Um, Knowledge of suspensions, truancy, academic grades, all this information which nurses have access to in a school setting will allow them to be that liaison to connect the student in need with a healthcare provider to address their mental needs. The second subject is that the mental health services from school-based health centers provide a sanctuary of understanding within a chaotic environment. Um, the findings of this article showed that these adolescent boys um, experience mental health problems that often relate to problems at home, problems in their environment, away from maybe problems in school or at home. But these health centers where they can receive mental health feel like sanctuaries to them. The counseling is a safe space. They can express themselves freely. As one child said, "She's easy to talk to, and when you talk to her, like, even when I'm not making any sense, she will make it. She's understanding what you're saying, even when you're not making one single piece of sense." I think that's profound. Um, this boy of Latino or African American descent feels like the place he can be most vulnerable and open is with his mental health counselor, which he got associated to within the school system. Here are two more quotes that you're free to read through. I especially like this quote where the student lets his feelings out and everything. And if you'd like, you're free to read a little bit more. This article is a very interesting take and perspective on the reasons why Latino and African American adolescent males are reaching out and seeking help, mostly through school based health centers, for mental health. I recognize that this article actually falls within two of the categories that we had available to us, which is the school based help, uh, that nurses can give, and also the help that nurses get through mental health. And I thought I would focus on the mental health here. I hope you enjoyed it. Have a good night.